I don't see any retractions.
No.
I don't see any seesaw breathing. I don't
No.
see any abdominal distension.
No.
Okay, I just hear the wheezing in both the anterior and also the mid-axillary. And can I have you lean forward for me, Kevin, and take a couple of deep breaths? Do I hear any wheezing, any
Yes.
crackles, any rhonchi in the lower?
Wheezing.
Wheezing, okay. So, going down and checking, I see no other physical injury. And my partner has checked, and we have full PMS
Yes.
at the end of each extremity. And Kevin can wiggle all of his fingers and toes just fine. Okay. All right, can I get my vitals? What's my pulse rate currently at?
90.
Okay, and quality?
It's still labored and shallow.
Okay, and he's tolerating that non-rebreather?
He is.
And what's my respiration rate?
24.
Okay, does he have a pulse ox now?
He does. It's 94.
Okay, so that is still a little bit low. And do I have a blood pressure?
110/82.
Okay, eyes are still pearl?
Yes.
Skin is still diaphoretic?
Yes.
All right, based on that information, I'm going to contact online medical control because the friend is back with his inhaler. Let him know what the vitals are, let them know what the physical findings are, and basically I have a 17-year-old male patient with a history of asthma, onset of about 20 minutes ago. He is currently at a 7 or 8 out of 10. As far as difficulty breathing, we do hear wheezing in all lung fields. He has a metered dose inhaler. He has not taken any of that metered dose inhaler. I would give blood pressure and pulse, which I'm not thinking of right off the top of my head, and ask if I can please administer 1 up to 3 doses if needed, because that's what Kevin normally takes, because I asked him that right. And I can give it 2 to 3 minutes apart if needed. And so what does OLMC say?
Yes.
All right, so I'm going to give Kevin the first dose while we're waiting for ALS here. I'm going to shake it up, and I'm going to put this around his lips, and I'm going to tell Kevin to go ahead and take a deep breath in, and as he does, I squeeze. Okay, hold that for a count of 10, and then we're going to have you slowly exhale. And then I'll be prepared to give another one in about 2 to 3 minutes as needed. I'm going to go ahead and have my partner take another set of vitals within about 2 to 3 minutes after administration before I give my next dose. Okay, is transport now available?
Yes.
All right, so we're packaged. We're en route to the hospital. I would consider doing a more detailed assessment once we were in the back and I was able to get more of his clothing off to check and make sure there was no other physical injury present. And of course, I would reevaluate the chest and the breathing difficulty. My ongoing assessment is going to consist of rechecking his mental status, his ABCs, rechecking his vital signs. And what are my vital signs 5 minutes later? Pulse.
Pulse is up to 120.
Okay, breathing.
Breathing is 18.
Okay, and his blood pressure?
Is 120/90.
Okay, and the eyes are still pearl?
Yes.
Skin is still diaphoretic?
Yes.
And do I have a pulse ox?
It's 98 now.
All right, currently my interventions are high flow oxygen. I've got Kevin positioned in a semi-Fowler's position on the gurney, and he is comfortable. Can I get a difficulty rating on my severity scale from him at this time?
It's a 6 now.
Okay, so it does seem to be that at least he feels it's improving and his vitals are showing the same. So I'm going to leave him on the non-rebreather for now, have my suction and BVM ready, and continue en route every 2 to 3 minutes to give him a dose of his inhaler, pull up per OLMC and contact the hospital and let them know our ETA. I'm done with the station.
Woohoo!
You guys got that all?
That's what we have to do.
That's how I do
Yep.
it before too.
You reach out